Welcome to the MS-Perspektive podcast. Perspective with a K, as I'm German. I'm Nele Handwerker, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com, you will find the show notes, 11 free tips as a PDF, and lots of other information. And now the show begins.
This podcast is supported by Mid-Mission, a project of the nonprofit Hertie Foundation.
Hello and welcome to episode number 9, where I talk about the Motoric Cognitive Risk syndrome in MS, or shortly MCR, with Dr. Alon Kalron. Dr. Alon Kalron is a senior lecturer at the Department of Physical Therapy and School of Health Professions. He works at the Sackler Faculty of Medicine and Sackler School of Neuroscience in Tel Aviv at the University in Israel. And now the interview begins. Hello, Alon. It's really nice to have you on the show today, and a warm welcome to Tel Aviv in Israel.
Thank you very much. It's great to be a host on your podcast.
Thank you. And before we start with the interview, it would be lovely if you could introduce yourself to the listeners so they know who is here on the show today.
Yeah, no problem. My name is Dr. Alon Kalron. I'm by profession a physical therapist, working in the field with MS a little over 15 years already. I have been working as a clinician also at the Sheba MS Center. It's the largest center in Israel, following over 4,000 patients with MS.
Wow.
In Israel, we have about 8,000. Also I'm chair of the Department of Physical Therapy at Tel Aviv University, at the Faculty of Medicine here.
Okay, great. And what was your personal motivation for that career choice? Which made you go into it?
It started about 15 years ago when one of my mentors, he introduced me to the field of MS, and mainly from the research perspective. And I was interesting at that time. Many things about MS, at least physical issues, were understood, but most generally. And he advised me and said, "Why not we take a look into MS and the physical properties a little bit, especially walking and balance and physical activity, to take a deeper look into this population, because relatively at that case, much less was known compared to today."
Yeah, I can understand. And it's great that we are going even deeper into certain topics. Let's come to understanding motoric cognitive risk syndrome, which we are talking today about. Could you please explain what the motor cognitive risk syndrome, or shortly MCR, is and how it is related to multiple sclerosis?
Yeah, for sure. MCR is actually it's a syndrome that was taken from Alzheimer. It's a combination of people who have both walking difficulties and the cognitive impairment. Instead of looking at each one separately, motor cognitive risk syndrome takes look into both of them at the people. It was taken from Alzheimer. It's a risk factor who those people or elders who will develop Alzheimer. And but we all know that in MS, both walking difficulties and cognitive problems are very common.
Yeah.
So I said, why not we look at both of these syndromes, or the MCR specifically in the MS population. So basically the term is people who suffer from both walking difficulties, and especially looking at walking speed. They walk slower compared to the normal population, and they have cognitive issues, which looking directly at memory. They suffer from deficits in their memory. So this is the basic term, first of all.
Okay. And you already said that it's quite common. Do you have an idea what the prevalence of MCR in MS patient is, and how does it vary by disability, disease duration, perceived fatigue, and fear of falling?
Yeah, sure. So according to a publication that we published on this issue, we examined 618 people with MS in total, that we had information about both the walking speed and cognitive issues. We did it with some electronic devices. I mean, it's not just a clinical measure, but also some kind of we used a walkway, electronic walkway, to measure the walking speed.
Mm-hmm.
It's called the gait right mat. It's just people walking across a mat, and then we collect all kinds of information. In this case, we focus specifically on speed, and we had information about cognitive issues. It was through a cognitive battery, computerized battery. There we collect cognitive difficulties in many different subdomains. And we could know if it's under normal, I mean, it's abnormal, yes or no. So according to our information, it was almost a little bit above 10% of the population that suffered from both. Both they had also slow walking speed and cognitive problems. That the 10% is very high, considered very high, compared to elders, let's say. So this was the prevalence of people with MSR.
Great, thank you.
We found that it was related with many different issues in MS. We found that it was related to disability level, what we all know the EDSS. Mm-hmm. And those were higher EDSS had a higher percentage of MCR. And we also found that it was also related with people who suffer more from fear of falling. Mm-hmm. It was also very high correlation, and also with fatigue, perceived fatigue, that we know that is a very common syndrome in people with MS.
Yeah. And how does MCR affect the daily life and the functionality of people with MS?
MCR, I mean, people also, it's not, I mean, we can't take it out of the context of just looking at mobility and cognition. And we all know that people who suffer from mobility deficits, it has it's a large impact on the quality of life. Mm-hmm. I mean, also just, walking to do the daily living things. So many of them have to use walking aids and different kinds of devices for the mobility. So of course it limited the all kinds of things that are related to walking, but also cognition. I mean, if you both have cognitive problems, then we know that it also affects your ability to all kinds of executive functions and memory tasks, and we know that the combination of both is quite alarming for people with MS, and it should be considered by healthcare providers, to look at both syndromes for these people.
Absolutely. And are there specific risk factors that contribute to the development of MCR in people with MS? Could you find something about that?
It's very hard. Like many things in MS, it's very difficult to look at predictors or how the disease. It's like asking about disease progression, actually. And we all know that it's very hard to predict disease progression. We know, however, that there are certain things that, limit or we can't stay stop, but at least they decrease the rate of progression. For instance, exercise. Mm-hmm. We know that it's very important for people with MS. I put aside the medication, that we all know that medication in generally, not even looking into each different company, but we know that it's helping to limit the rate of progression. But also things like exercise, that I'm also very interested in. We know that when people exercise more, then these outcomes like walking disability is much better. Also, people, and if we look at cognitive issues, we know that people who have more social interactions, it's very important for these people. Let's say any activity that triggers cognitive challenges is something that we can say is in favor of these patients. Mm-hmm. And if we look on the longer run, it decreases the rate to develop the MCR. Mm-hmm. So these are very important things that people with MS should acknowledge.
Yeah, absolutely. What are the potential cognitive impairments associated with MCR, and how do they affect the overall well-being of people with MS? What would you say?
We know that cognitive issues develop, it could be developed as solely the major issue with people with MS. And it could come with combination with the other syndromes itself. It's hard to say exactly what negatively affects cognition. We know that in some ways it's could be related with background of what we call the cognitive reserve that mm-hmm. people develop throughout their lives. If it's social activities, hobbies, many different aspects can be related with cognition. But as I said, the best advice is to keep interact and what we say, use the brain. I mean, once we use it, I can't say we don't lose it, but we preserve it.
Yeah.
So it's very important. We know that it's related with fatigue that people complain. People who complain that suffer more of fatigue. We also know that there's cognitive issues in the background, or maybe not in the background, it's in front, but it's related. So these issues, I mean, it should be. I mean, everyone finds. I mean, there are different ways to deal with it, but it's very important to find the path, even on the individual basis.
Yeah. And you have to use both, yes, your brain and your muscles, right?
Yeah, the brain and muscles, they work together great. I mean, movement, they say that movement doesn't have any, I mean, it's a way to use the brain. I mean, there's behind movement, there's some kind of goal. You're trying to do something, and the goals are using the brain.
Yeah.
So these things, the combination goes well together.
Absolutely. Can you provide some insights into the relationship between MCR and physical disability in MS? How does these factors interact?
As I said, the MCR is highly related with the EDSS, with the rate of disability. People with what we call moderate or severe disability, we can see the larger proportion of the MCR. I can't say there's a cause effect. I mean, it's the disability, and the MCR is a picture of the disability. Mm-hmm. It's not that it's creating the disability. It's just looking at it at a different way. But of course, it's, as I said, the MCR is a different perspective of combining two major disabilities: the mobility and the cognition.
And so this answers already the next question. I mean, there is a relationship between the duration of MS and the likelihood of developing MCR, because I guess
there is a relationship, but it's not as clear as disability by itself, because we know that patients, the disease progression is very different between patients. Of course, those with progressive disease, as the relationship is faster. I mean, it goes side by side. But we know that patients, in many times there's a long gap between attacks or between the rate of progression. So it's much more related to the disability by itself than the disease duration.
Okay. Great. And how does a perceived fatigue influences the presence and progression of MCR in MS patients?
We looked at perceived fatigue as social. We know that fatigue has different components.
Yeah.
We have the cognitive, social, physical, and fatigue in generally is highly related with cognitive deficits. So we can see that people with higher fatigue also have much more cases of MCR. It's always, you can't say the cause or who was first or who was second actually, but let's say by our study now, it was a cross-sectional. We're just looking at the population itself, but we know that they are related to each other, these common symptoms.
Okay, and you also named the fear of falling. So what impact does fear of falling have on the development and management of MCR in people with MS?
First of all, fear of falling is, if I look at it separately from falling by itself, is also a symptom that has to be looked at, because fear of falling by itself, even those who don't fall, they many times they limit their activities. Mm-hmm. Because the fear itself is something that we have to confront. Mm-hmm. It's combined with both the cognitive and the mobility, because people who fear, they tend to, let's say, do less activities, go out less out of the house, and then their physical conditioning gets worse. Mm-hmm. So, and we know that those with MCR have a high level of fear of falling. So, as I said, the fear of falling that we know that is a highly prevalence in MCR is something that physical doctors or just people have to ask themselves if they suffer from this fear of fallings. Mm-hmm. Because it can be helped. I mean, you can develop all kinds of different strategies to reduce this symptom. That is very important, in my view.
So that it's not a downward spiral and
exactly.
Limiting,
they
and
start fear and the deconditioning, and they go less and they do less, and then the cognitive issues start to take a larger account. I mean, it's something with proper guidance. Mm-hmm. I mean, you could actually help many of these patients.
Fantastic. And that was a great introduction for the next topic, managing MCR in MS patients. Are there specific strategies or interventions that can help MS patients manage MCR and mitigate its effects?
Okay. And like I said before, if someone is categorized as MCR, he has both. He has both cognitive issues. He have walking disabilities. Now we have to look at both. Mm-hmm. And as I said, there's many different ways by managing to direct both. As I said before, physical activity is one of the main issues, in my view. Not only, but many, because physical activity improves mobility for sure, but also it helps cognitive issues. There's also some kind of combination between these two for practice. Let's say we call it the dual tasking mm-hmm. training. Dual tasking training is, let's say, you're doing a motor activity like walking, mm-hmm. but at the same time, we're giving all kinds of different cognitive challenges. And then once you have to do both at the same time, you can actually improve each one of them separately. I mean, instead of just walking or practicing walking or practicing cognitive training, let's say, in a sitting position, once you do both, it's a way. I'll give an example, but let's say we did a study once that people were walking and at the same time they had to do all kinds of numerical calculations or give specific names according to the alphabet. I mean, and you do it while you have to maintain your balance or you have to maintain your walking. And we saw some promising results of people that improved both their walking and their cognitive issues once they did it together. So it's also an interesting way to manage these deficits in MCR.
Great. And if you do it outside, you can even get some vitamin D. Fantastic. And more oxygen.
I mean, in daily life, we do both things. I mean, when people walk outside, or you have to get to somewhere, it's navigation. Let's say I have to get to a shop or I get to a place that I don't know exactly what. So you're doing that thing because you have to walk and you have to think where to
how to get there.
Yeah, how to get. So it's some kind of a daily life activity. We could look at it.
Yeah, and you can train that, yes. And they do that when I have they have in Dresden, where I'm at the MS center, they have this gate map or a gate thing. And I have to do it. And then I have to do something with the alphabet and with the numeric, but not for training, but for checking if my walking is still fine. So I do this every half a year.
I think there's something that's also famous that could also help. I haven't checked it, but I think potentially it could work. I don't remember how it's called, but you know, the navigation in the woods, do all kinds of activities that you with a map.
Yeah. Where you kind of a treasury hunt.
Yeah, it's like it's a sport. But if I look at it for people with MS, you know, if you don't look at it as a competition just for fun, I think it's a great thing to do. Just doing an activity, combining some cognitive challenge, how to get to certain places, and you have nature. That nature always helps.
Absolutely, it relaxes, and you have these different. You can smell different things. That's good for your senses because they train the brain as well, right?
And you have another two very important factors. It's fun. Why not put fun? Fun is always helps.
Absolutely.
And it could be as some kind of a social interaction. People could do it together, groups. So
absolutely,
these are kind of things that will help all different symptoms that people with MS suffer.
Yeah, and for the people who live in the cities, they can do it even in the parks. It would be okay, kind of a bit nature.
I mean, if you remind, it's things that people once. We used to play these things as young children, going to finding things, going back to the future, back to
childhood.
Yeah. They were nice games that actually child games in many aspects. They are developing cognition and our physical abilities. It's something maybe we could look back into.
Absolutely. What is the role of healthcare professionals in the management of MCR? What types of professionals are best suited to treat the syndrome?
I think many. I mean, first of all, to detect it, it's the physician, neurologist. I mean, that are aware of the physical condition, walking ability. It's some kind of a checkup that the physician should should manage. First of all, detect it. And as a treatment, I think physical therapist, it could be also cognitive is more psychologist or people who are trained for cognitive training should also be involved. And if we're talking about physical activity, educational trainers, personal trainers, I mean, with proper guidance, I think they could all work together and work for the best of the patients.
Yeah. Can you explain the importance of early detection and treatment of MCR and MS, and how does this impact the long-term outcomes and quality of life?
I think as many aspects of MS, the faster people are receiving the proper treatment. I mean, we see it in all directions in MS. The medication is given earlier. Everything is given earlier because they said that once you lose, it's hard to, I mean, it's easier to preserve brain volume, brain activities or everything that's related to the brain before damage occurs. So even in this case, the earlier, the better. But still we want to people maintain their normal life. And, it should be combined with normal activities. It's not that it's a best way to preserve, to maintain the disease, and to decrease the disease progression. So I suggest earlier the better, and to modulate the activity according to daily life. For young people, of course, it's different than older people, but everyone could benefit from some kind of tailor program.
You mentioned already quite a lot, but can MS patients make certain lifestyle changes or practice self-care to minimize the impact of MCR on their daily life? Something you have not mentioned yet.
Yeah, I think we talked about it quite a lot. I like it when people insert activities, but it doesn't interfere with their normal life activities. People have a job, have a family, have many things that they have to combine. It's important to put into these significant activities. Physical activity. Physical activity doesn't have to be some kind of extreme sport. Physical activity is just, instead of going by the stairs, instead of going by the elevator, take the stairs.
Yep.
Or even small. Everything counts. They say every step counts. So every activity, brain activity, physical activity counts. So, take advantage of what the daily life puts in front of you.
Yeah.
And I think this is a very important advice.
And maybe you see the young children as good examples. When I go with my little one to the playground, I use the things on the playground as well to train my balance or some other things when I don't have to hold her hand.
But just
I use it.
Just chasing her is activity.
Yes, of course.
That's extreme physical activity sometimes.
Yes.
Just taking care. Yeah.
Absolutely. What support systems or resources are available to help MS patients dealing with MCR? Are there certain organizations or communities that offer help?
It's not specific. It's it goes with all other healthcare organizations with MS. It's not specific. We don't look at it as a specific issue. The things that are common that are used today are the same in this aspect.
How can MS patients proactively advocate for themselves and ensure they receive appropriate care and support for MCR?
As I said before, it's exactly like any other physical activity, any other physical disability that they need to confront. So as I said, MCR is a different way of looking at different kinds of symptoms, disabilities. It's not by itself exactly something, separately treated. It's mobility, cognition, but at a higher degree. Mm-hmm. So for sure, these patients have to be treated.
Yes, and please, I would just add, please talk about these issues when you have them with your doctor, and don't try to be the, looking bold that you don't have these issues. Please talk about them so your physician knows about it.
It's very important to talk to your healthcare manager, healthcare professional about these issues, because there are treatments. And actually, it's expected that the healthcare professional would ask about it. But if not, it's very important to talk about it, to rise the difficulties, and try to think together of solutions. The best solutions come when both sides think together.
Absolutely. And I think these questions are raised at MS experts, but not every MS patient is treated by an MS expert. So that's why I try to mention it here.
It could be also, people with cognitive issues, sometimes it's also important for a family member to raise it for them. Because of the cognitive issues, sometimes it's forgotten, let's say. Yeah. So family members should also feel free or it's important that they also raise it. Mm-hmm. So the patient itself gets the best treatment.
Yeah. Is there ongoing research or progress in the field of MCR and MS that holds promise for future treatments or management strategies?
I think there's a lot of research into the domains of MCR, a lot of research into cognition, how to treat cognition. We know that there's no specific medication for it. So we're looking at different kinds of exercise training to improve cognition, and also for physical or walking difficulties. There's a lot of research looking into it, and it's very important, as I said, much more than, let's say, 10, 15 years ago or 20 years ago. People are more aware, and people are looking more for advice. They're doing much more. Many medical doctors told me that MS departments today don't resemble at all what was 30 years ago. It's totally a different atmosphere. People are much more active. They're looking to be active. And I think the treatment is getting much better, even beside the medication that improved. But even in other aspects, they're getting more. And we're all the time exploring more and more new kinds of activities.
Great. Can you maybe share some positive experience of MS patients who have achieved good management of MCR and regained quality of life?
As I said before, I mean, many patients that we know that participated in all kinds of exercise activities, we saw positive results, more on the mobility, but also in cognition. There's large studies showing it now also, let's say, in progressive MS. So that even is more encouraging. So I can't say that it helps all, but as a group, it does. I mean, it benefits a large segment of these patients, and we're just continuing looking into these patients.
Great. Is there anything else you would like to share with the listeners?
I think I shared a lot.
You did.
As I said, I think one sentence. If you want to remember one sentence, then I think every move counts is a very important sentence. It's also even relaxing to know that every move counts because I can do it. I can do something. And as I said, I think the future in this field is quite impressive, and we're looking forward all the time to improve health benefits in the MS population.
Yes. And maybe I can just share an insight from a German interview, which I had on sport and MS. And there was a lady sitting in the wheelchair and she started climbing. I mean, she was not exactly an MCR person, but later on she was able to play even table tennis standing and went into climbing. So moving can be a lot, and you can start with a little piece and go from there and increase it maybe over time.
I also saw it. People are doing activities in the water activities. Many people I saw, people are doing all kinds of paddle. I don't remember the names exactly, but windsurfing, you know.
Windsurfing, wow.
Look life bright. Look, it's bright. And any activity that people also like, go for it.
Yeah. How and where can interested people follow your research activities?
Okay. First of all, maybe I have maybe in the LinkedIn, so you can follow me in the LinkedIn. In the LinkedIn, I from now and then I certain post about my activities, mainly research activities. Groups that I'm involved with, research groups. So that could be a place to look me up if you want.
Great. Alon, thanks a lot for sharing all that positive insights and making people to think about that every move counts and that it doesn't have to go in one direction. You can turn that into a positive side if you start to train your mobility, train your cognitive functions, and you can regain things. Of course, it's always better to preserve. You mentioned that a couple of times, but it's also possible in the progressive state to gain back mobility and all that. Great. And thanks a lot for all your research.
Thank you
thanks
very
a
much.
lot.
It was a privilege to participate, and I hope I'll be listening to your podcast.
Thanks a lot. And bye-bye to Tel Aviv.
Thank you very much.
I hope you enjoyed the interview and learned something new and maybe got even motivated to move more. That would be awesome. By the way, next time I will talk about the disease-modifying therapy and all the things that are important around that one. Why you should use one, when it's time to change, and what different types of disease-modifying therapies are out there. It would be lovely if you tune in again, rate the podcast on the platform of your choice and recommend it to others. And I'd love it if you send me a picture or a message where you listen to the podcast. That would make it more of a dialogue. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.